it's your Houston chiropractor, Dr. Gregory Johnson. We have Ryan back with us today, and we just reviewed Ryan's x-rays with him throughout his cervical, thoracic, and lumbar spine and pelvis. So what did you see in the x-rays that matched up with your posture? Pretty much everything, right?
Yes, sir, a lot of bone spurs.
Well, that too, but he has some degenerative disc disease and osteoarthritis, degenerative joint disease. Those are all synonymous terms describing degenerative changes that occur in the spine over time, and that's because you played lots of football and athletics in the younger days,
yes, sir,
repetitively, and still are,
yes, sir,
active in martial arts.
yes, sir.
Yeah, so I wouldn't want to fight him right now. Okay, but see, he's a big, strong guy, and he has a high pain threshold, but he's got some serious issues in his spine, which he's smart enough to take care of at his age, and that's young, I mean, and get rid of these so we can keep his spine from fusing, and that's what would happen if he would neglect this. So, by the way, I'm wearing a Chirotrust shirt today, which is an elite group of chiropractors all over the United States. We get calls from all over the world every day from people watching our YouTube videos wanting to say, is there a chiropractor just like Dr. Johnson in New York City or Miami or Chicago, LA, you know? So we tell them different chiropractors to go to, and I like to mention a couple of them right off the bat. Dr. Evan Davis out in San Francisco at Executive Express Chiropractic. Dr. Barry Marks in Orange County is great. Dr. Tammy Cashin up in Virginia. And let's see, Dr. Russell Brookstein up in New Jersey. And anyway, those are the closest doctors that do what I do, because they don't do physical therapy modalities and gimmicks and waste your time. They're hands-on adjusters, and they follow a pledge that they have taken to get you in and out of the office as quickly as possible and get out of pain and not keep you on year-long treatment programs and a $10,000 contract to do that. So we charge reasonable fees and get people in and out of the office and in and out of pain. Is that what we've done with you, Ryan?
Absolutely.
Okay, great.
Yes, sir.
So you pick your own schedule, right?
Yes, sir.
Okay, good. All right, let's have you flex your head forward and backwards. See, I treat a lot of big guys in here. You've seen a lot of videos here recently of me treating really big men, and Ryan is one of the bigger ones. It's nice to be able to look up at him. That way I don't get forward head posture. Okay, so he's got a little translation and forward translation in his neck here, forward and to the right. So his left shoulder is a little higher, and he's had problems out into his left shoulder as a result of pinching in the brachial plexus down here at C5 and C6, which is degenerated as well. And then his pelvis is translated to the right, and his right hip bone is elevated there, so his spine's starting to compensate for that all the way up and down. So let's go ahead and get you on here and decompress you first, Ryan. I don't have a front pocket here today, so I'm kind of lost on that. So let's get you up. This is our Friday. We work Monday through Wednesday from 8 a.m. to 6 p.m., but we haven't been getting out of here till like 8 p.m. all week because we've been so busy. But that's a good thing. We get here at 8 in the morning. So Monday through Wednesday is 8 a.m. to 6 p.m. And then Thursdays we work from 8 a.m. to 3 p.m. and then take Fridays, Saturdays, and Sundays off. And most Chirotrust members do that throughout the United States. But you're going to get quality care with Chirotrust members. Take a deep breath. Okay, I got one more here. There we go. All right. You feel that all the way down?
Yes, sir.
All right. All right. See, he's still, well, he's not got much kick in him today. A little bit right there. Okay. And no, he's not dead. I saw a few of you put it down. Oh, he's not kicking. He's zombie. Okay. There. Let me in. Now, see, even though he's got a lot of disc spurs and osteoarthritic spurs in his cervical spine, we are still getting good movement throughout his cervical spine, which will keep his cervical spine from fusing together, and that's great. Were you surprised to see your x-rays like that today, Ryan?
I saw them several years ago, and they didn't come up much better, to be honest with you.
Oh, really? Okay. There we go. Okay, let's go on each tummy. Now his left leg is short by about a ½ an inch in this position. When I bring his legs up, it gets even, and see his pelvis raised. That tightens up in your lower back right there, doesn't it?
Yes, sir.
Yep. So his left SI joint right here is off. So we're going to adjust that first, along with his hip joint simultaneously. And he has some beginning degenerative changes in his actual hip joint, so we adjust the hip joint as well. And I'll show you how to do that from the other end here in a minute. The right SI joint, which this one's higher, so I'm pushing more superior to inferior on this on the y-axis to bring that back down and even it out. And then the sacrum on the right's also higher, so I'm pushing that one down. Left one we're just going to even out. Now we're going to hit L5, L4, L3. That was probably the most sore right there. There's L2, L1. You can see the angles in my arm changing. Now I'm down his lower thoracic. Just exhale for me there, Ryan. Okay. Keep breathing. Okay. Yeah. There we go. Okay, I'm going to put your head down a little bit to open these up. Okay. All your air out. Boy, you tied up there today. Let me see if I can get one more right here. Yep, I knew it was there. One here, two. There we go. Good. Now his legs are exactly even, and does this feel any easier coming up this time around?
Yes, sir.
Okay, good. But he's still got some pretty significant muscle hypertonicity in his pelvis, in the gluteus medius and maximus right here. I'm sure he's feeling that right now. Ooh, that one's really tight right there. You feel that one more?
Yes, sir.
Yep. Notice he's not quite talking as deep and loud on that one. It's pretty hard to do when somebody's got their elbow in your gluteus maximus and medius muscles. Then get right down here in the pocket, I call it, right down the quadratus lumborum, multifidus, and erector spinae muscles where the lumbar spine meets the pelvis. Yep. This is one of those hurt so good things.
I wouldn't say good.
You know, Ryan's not thinking it's so good right at the moment, but he'll feel better when he quits hurting.
Yes, sir.
Oh boy, there's another tight one. Usually when you have problems in the lumbar spine, you'll see that the thoracolumbar spine is very tight too. Now, Ryan really loves this. Most everyone, I don't care how big and how athletic you are. You get the old white knuckle syndrome on that one. Grabbing the table really hard because you're jumping around there where it hurts so bad. But it digs deep into the tissues and breaks up fibrotic adhesions, gets rid of metabolic toxins in the muscles that have built up and get sore and tense, releases them out into the bloodstream, which is what I'm doing right now, is improving his blood flow in all these areas so his body can expel the metabolic waste products of normal everyday cellular metabolism that's going on in his paraspinal muscles and joints. By the way, all the synovial joints, they have to go through a metabolism as well. And the synovial joints actually is the reason that you hear the popping noises when you get adjusted, because all the cracks that you crack addicts like, the popping is a carbon dioxide and nitrous gas that explodes in the synovial joint because the synovial fluid in the synovial joints, which is every joint in your body. That's why you can crack almost every single joint in your spine or your extremities too. I've even cracked people's bones in their ears. You got 3 bones in the ears, the malleus, incus, and stapes. This feels a lot better than the turbonator, huh, Ryan?
Yes, sir.
Alright, so I'll give him a break here in the end, leave him feeling good. Now, tell me if there's any pain in your lower back right now when I do this.
No, sir.
Okay, great. Okay, let's have you sit up. Or turn on your back first, and let's get your hips first. So now I'm going to adjust his actual hip joints, which are out here. A lot of people think their hips are back here. That's really your SI joints. So he's got legs like tree trunks. It's hard for me to miss these guys. Just breathe. There you go. So got good movement in his knee. Did you feel that up in your hip joint too?
Very much so.
Okay, good. So we're going to keep him from fusing together every one of his joints throughout his knees all the way up. So face towards your knee. Yeah, take that on that left shoulder. I'll take it easy.
I don't know why I'm not going to take it easy on it.
Okay. There we go. Got good movement in the glenohumeral joint on the right shoulder. Now he just had an injection in this left shoulder because he has some bursitis and tendonitis. So we work with some radiologists and pain management docs here in Houston that we use as complementary sometimes. Sometimes we even have to refer people out for surgery. We had a lady in here yesterday that had a space-occupying lesion in her spinal cord. Chiropractors cannot adjust those. So we sent her off to a neurosurgeon here in downtown Houston. Excellent. That elbow moved good. Excellent. Yes, sir. Okay, now let's come over here and shoot you. Now you wouldn't think I'd be shooting a guy as big as Ryan face to face like this, but we're going to hit him with this Atlas adjustment instrument. And he saw on his x-rays today that his atlas is translated to the right, and that's why his head's translated and tilted to the right. That looks better already though, doesn't it? Let's flex you forward and backwards for me again. Excellent. Now, let's pull these shoulders up and back. We'll bring the head straight back in the Z-axis, and I'm going to translate you straight to the left. Here's the right translated atlas there. Now I adjust it on both sides because what this does, this is a high velocity, low amplitude adjusting instrument that lets it bounces the atlas back and forth laterally because you can't go forward and backwards with it. Our ligaments there in the dense process. Okay, let's flex you forward and backwards again. This should feel even smoother.
Yes, sir.
Back to neutral. Okay, so we still need to work on getting his head up and back. So what's your exercise, show us? Your exercise that you do for your shoulders and neck? When I showed you, up and back, remember?
Right, up and back.
And then translate left. Translate like that, right there. So this is his correction exercise right here. Okay, you can relax. And just hold that for like 3 to 5 seconds. It's an isometric exercise. And so, this is your Houston chiropractor. Chiro Trust member in Houston. Find you a Chiro Trust member where you live in the United States. And we'll see you next time.